One thing that has been in my heart is talk about HIV/AIDS, and we feel that in Hong Kong, stigma is a very important and a significant problem.
Poverty and hunger actually lead to many diseases, which then link to the medical curriculum. I think actually some people are actually suffering, but you can't see them because you're in such a comfortable environment, such a comfortable place at home, that poverty or hunger never actually strikes to you as such a big thing. And
we found that we have attracted a lot of university students to our counter to understand more about the goals, because previously I don't think many of the students even heard about the MDGs, but after coming to our counter, at least they have a knowledge about the 8 goals and what the United Nations were trying to do in order to help the world.
And what we did was we invited people with HIV/AIDS and for asking them to come and just share with us their experiences.
We distribute condom on the day before the Valentine's Day and try to promote safe sex, because
we have to learn more about these goals, and we have to pay more attention to what's happening in our society so that we can actually use our knowledge and try to change the things around us.
I think that first we have to know about the things that are happening in the world, and second of all, we have to care about what is happening in the world.
Being a good doctor is not only about understanding this academic part, but also the social part, the global part of this aspect. So we are about to appreciate that it is important for us to look beyond what we are comfortable with, what we already know. And I think the MDG is an unpaired opportunity to unite us as the future doctors to strive for this common goal as a single unit. And
give initiatives or perhaps voluntary services or any kind of projects that involve these students into improving the situation.
We can put up posters, we can have sharing sessions perhaps with with inviting people who have relevant expertise in various areas related to those goals, and we would ask students and maybe just the general public to come to.
So yeah, I think seminars, maybe some discussions would be great in terms of global development, global health. That is something I feel is a little lacking in our curriculum. But do I really know about the world? Do I know what I can do after I get an MBBS degree? I think if we know what we can do with our degree and you know the impact that we can make, a lot of people would be more even passionate to know about these things and to make a difference.
We should use a more interactive format. And I think what we can try to do is to have a video sharing, or try to hold a day or an afternoon or about a special program involving the whole class to do something in the community concerning the development goals. And yes,
we can ask the medical students to self-initiate some maybe street promotion or demonstrations, or maybe simply just doing research on certain aspects of the MDGs, and to present it to other students, because I think into doing actual and concrete stuff and trying to tackle these problems would be more effective and helpful in their understanding and learning of these MDGs, rather than having them sitting in a lecture hall and having...
It would be great if the faculty could bring us to different locations where most people are poverty-stricken and hunger-stricken, see them firsthand, do some voluntary experiences, work with these people.
Introducing this MDG into the medical curriculum, I look for it to be socially relevant. So social theories and psychological behavior models, what their scholars says about different social theory. These are important, but
I think one problem of medical curriculum in many places, not just in Hong Kong, is that the 5-year medical curriculum is very intense. It is understandable that nothing or not much other than medicine could be taught during the 5-year medical curriculum, but at the same time it renders not much more than a vocational training program, because some of the goals, such as maternal health, such as HIV and AIDS, prevention and awareness, would be more relevant to the medical curriculum because they are of their because they're infectious disease, because they're related to public health, community medicine. I think as a head start, these components could be incorporated into the medical curriculum first. Then what should the curriculum provide would be opportunities such as compulsory classes on these issues in a less academic way, presented in a less academic way, because students tend not to be interested in things that are examined or formally assessed. And one way of doing it would be perhaps inviting different guest speakers to different lectures to speak about their personal experiences. It could be case studies. Those things would be more interesting. And I think as a final note, since the inception of the Millennium Goals in 2000, and now it is our time period half of the time period has passed, and the deadline is 2015. And as shared by many people, Mr. Ban Ki-moon, the UN Secretary General, has noted early in Geneva that according to his and many others' observation, the progress of achieving those goals have been really slow, and in some regions, in some aspects, are even backpedaling. It's going back. But we should not be submerged in the atmosphere of defeatism. Because we cannot do that in 2015, we can do that in 2016, 17, 18, or later. But we should not be defeated by the current I should say, maybe slow progress of the achievement of these goals.